Hi, today I will talk about diabetic retinopathy. My name is Sausan. I'm a master's student in diabetes care at University of South Wales. Diabetic retinopathy is considered as the cause behind the 10,000 cases of blindness annually in the United States. It is also known as one of the most common microvascular complications of diabetes. Hypertension and hyperglycemia are the main causes of retinopathy in type 2 diabetes patients in the UK. If you have type 1 diabetes, diabetic retinopathy could affect you early due to prolonged exposure to hyperglycemia. If you have type 2 diabetes, the risk of being affected by diabetic retinopathy is high if you have prolonged hyperglycemia pre the diagnosis or if you have poor control of your blood glucose level. Diabetes or hyperglycemia could cause diabetic retinopathy by directly affecting the walls of the blood vessels, which could lead to non-proliferative diabetic retinopathy or proliferative diabetic retinopathy. The non-proliferative diabetic retinopathy is the first stage of diabetic retinopathy in which the retina has a microaneurysm retinal bleeding and hard exodus. In this type of diabetic retinopathy, the blood vessels of the retina are damaged slowly without the growth of new blood vessels. It is low risk to get the severe complications such as blindness in this kind of retinopathy. The symptoms of non-proliferative diabetic retinopathy are blurred vision, fluctuating vision, and impaired color vision. There is no specific treatment of non-proliferative diabetic retinopathy. However, it is mostly can be controlled by having intensive control of blood glucose level, control your blood pressure. The American Diabetes Association recommended the systolic blood pressure that is less than 130 mmHg to prevent any progression of diabetic retinopathy. Lifestyle modifications such as enhancing the daily level of exercise and eating a healthy diet. These modifications helps to lose weight, which enhances the blood glucose and the blood pressure levels, and regular monitoring. The second type of proliferative diabetic retinopathy is proliferative diabetic retinopathy. It is considered as a severe level of retinopathy that could lead to severe and permanent complications such as loss of vision if it is not treated immediately and properly. It happens when the retinal blood vessels are damaged and new abnormal fragile blood vessels grow, which are easily damaged and start bleeding, which could lead to retinal detachment that could cause permanent vision loss. The symptoms of proliferative diabetic retinopathy are severe vision loss, blurred vision, sudden appearance of flutters, dark or empty areas in your vision, and having difficulty with color perception. The treatment of proliferative diabetic retinopathy is more urgent and aggressive in order to prevent the severe and permanent vision loss, and it includes laser therapy, anti-VEGF injections, and vitrectomy. Laser therapy is a focal penetrating photocoagulation treatment that is used to seal the leakage of the blood vessels that could help in reducing macular edema. You may need 3 to 5 times laser sessions. Before the laser session, you will get analgesic eye drops and eye drops that enlarge the pupil. Then the doctor looks in your eye by using a microscope, and you get lenses before your eye is exposed to the laser rays. Every laser ray is being considered as a flash that appears while taking a photo. The treatment is about 5 to 20 minutes long. Usually the treatment is not painful, but if you experience any pain, you can ask for a painkiller tablets. In the first minute after the session, you will not be able to see anything since your pupils are enlarged, so you will not be able to drive. The doctor recommend you to have sunglasses to use after the session. Mostly it takes a few months until you notice the effect of laser therapy. Anti-VEGF injections. It is a medication that reduces the growth of new abnormal blood vessels as well as decreases the fluid buildup. A combination treatment of laser therapy and anti-VEGF injection could be used in some cases. The injection is given in the operation room while you are lying down in bed. First, your eyes are washed by a special eye wash, and then an analgesic eye drops will be used. Antibacterial eye drops will also be used as a prophylactic antibiotic. A special plastic equipment will be used to hold your eyelid open during the injection. After 30 seconds of these eye drops, the injection by anti-VEGF will be given, and you will feel some breaks during the injection. After the injection, it is common that the eye will be red and you may see some flying dots that will disappear after a few days. The injection is mostly repeated every month for 3 times, and the treatment evaluation will be done before the 4th injection. Vitrectomy. It is a surgical treatment that is used in advanced proliferative diabetic retinopathy. The operation procedure includes removal of abnormal blood vessels and the scars from the retina. After these treatments, it is important that you have intensive control of your blood glucose level, control your blood pressure, and follow a healthy lifestyle. The complication of diabetic retinopathy. Diabetic macular edema. The macula in the eye is responsible for the sharp vision. When the blood vessels of the eye are affected by retinopathy, their fluid permeability increases, which leads to fluid leakage from the blood vessels in the macula that leads to blurred vision. Retinal detachment. It happens as a complication of retinal blood vessels bleeding and scars formation in the retina. The retina should be immediately reattached to prevent permanent vision loss. Diabetic retinopathy is a leading cause of blindness in young people, and its prevalence is significantly high among diabetic patients, as it could reach to 34.5%. Having intensive control of your blood glucose level, controlling your blood pressure level to reach the recommended systolic blood pressure, and following a healthy lifestyle could protect you from being affected by this eye disease. That the complication of its progression could be prevented by this intervention. It is important to seek help early and contact your GP if you notice any vision changes. Hope you find this video helpful for you. Thank you so much.